Hello, you are listening to Trump Republic Radio. It is May 9th, 2017. I'm your host, Enzo Quesada, and always I'm joined by my co-host, Bobby Hester.
Hello, everyone.
This is the second Midweek mini podcast that we're doing. We're planning to do this every single week. I believe we might even do two this week, maybe. We'll try to spread it out. It's nice getting more content out, especially the shorter episodes. I feel like people appreciate that we make episodes for people that don't want to listen for 3 hours. Even though I do love the Sunday show, it's the best. But today we're going to be talking about healthcare, specifically ways that I believe we can improve healthcare. I know Bobby has a lot of tax reform that he wants to propose that could definitely help the healthcare situation. But I'm going to be more focused on reform we can see as far as rolling back regulations, trying to add more market principles that can work in the healthcare system, trying to propose some Medicare and Medicaid reform. And I'm not an expert in this. Bobby's not an expert in this, so we might not be 100% correct about everything. I'm not sure how well we'll get through this all, but we'll do our best to be as informative as possible with this. I think with that, should we start off with your tax reform, Bobby?
Well, I was actually thinking that we do tax reform as we go along. If you mention something, I can say what tax policy I had that went along with it. Or if we get to the end, then I can just go over it.
Yeah.
So
maybe we should start with the current situation that we have Obamacare. We have a couple articles up for that. Yeah, let's pull up this one on premiums increasing by state. Now, if you don't know the current situation with premiums, we've seen premiums rise this year in every single state. We've seen some states having drastic increases. Like, are you aware of Arizona? I know Arizona has had huge increases in premiums.
Yeah, Arizona's premium increase this year for 2017 is up 116%.
116%.
And that is the highest in the country of all of them.
Yeah, I know there's a couple of states that are very similar. Arizona is down to, I believe, only one insurer for Obamacare, which is one of the main reasons why this, Obamacare is not working and why healthcare reform is so important right now. As we're doing this show, the Senate is looking to redo the American Health Care Act. It passed through the House, but they are looking to write their own bill. So that's going to have to go back to the House, but they're looking to build off that. Now, I know we're both not the biggest fans of this GOP healthcare bill. It could definitely be better, but I know tax-wise it's probably better than most things that you could put out there. Would you agree?
Yeah, it removes a lot of stuff, especially the one of the penalties for not having taxes, I think, is like up to almost $700. It reduces that down to zero, and just tax-wise, it does produce some extra thing, including removing some penalties for companies that have healthcare plans for their employers or employees.
Yeah. So do you have that thing with the premium increases by state?
Yes, I do.
I think maybe we should list out some of the worst affected states.
Yeah, so
just because no one really has reference outside of their state, and most of our listeners live in Texas. So
yeah, so as we said, Arizona is the highest in the nation at 116% increase. Most states do have a slight increase of at least something. Texas, for instance, our percent increase is 18%.
18%.
But our actual premium number right now is $261, which I'm guessing is monthly.
Yeah.
And even though a state like California, which only saw a 7% increase, their premium is still higher than ours. So you have to both look at like the premium and the percent increase. Like some states, for instance, in Indiana, their premium is $229. That's actually down 3%. So there are some states where the premiums are going down. But for the most part, we do see increases across the board.
Yeah. We're also seeing a lot of insurance companies getting out of the business because it's no longer profitable under Obamacare. It looks like Anthem is looking to exit because of the Obamacare. They're looking to get out of the insurance market by 2018. Anthem, if you don't know, offers the insurance under Blue Cross and Blue Shield, which is in 14 different states, and it is still one of the largest companies that still offers coverage through the Affordable Care Act, but yeah, that's looking to go pretty soon now, and I believe there are maybe some states where that's the only insurer. I can't confirm that at the moment, but it's definitely a very important one. We've already seen United Health Group and Aetna leave most states, and Humana is also planning to stop offering an individual Affordable Care Act plan by 2018. Now, when Anthem leaves, it's gonna especially impact Colorado, Kentucky, Missouri, and Ohio. And these states will have no insurers for Obamacare once they leave. I just read my own answer to before, but so definitely there are a lot of states currently that are in a lot of danger of just the healthcare market completely going away. But yeah, so that's just a quick summary of how it is at the moment. Things aren't great. I hear so many people with propaganda, it seems, on the media saying, like, oh, it's such a popular program. Everyone still loves Obamacare. We need it so much. But Obamacare is the biggest weight in us having a healthy insurance market. And there's definitely a lot of different ways that we can improve it. Now, there are two organizations that are really, really good as far as healthcare goes, or healthcare proposals from kind of conservative or libertarian-leaning organizations. The first one is the Heritage Foundation, which I find their proposal for a repeal and replace to be the best that I've seen. I've looked around this for a while. I've been researching this for probably the last month or so. I've been taking like spare time when I'm teaching just to look it up on my phone and try to write down different ideas. The Cato Institute also puts out a lot of different good ones, and they kind of have a more of a economist-based one. But probably the biggest problem with Obamacare is that it has so many regulations. It prevents insurance companies from even really functioning to be profitable. It prevents them through bureaucracy from offering lower costing plans. It requires them to have all these different provisions that really inhibits people from having affordable health care. What we see a lot of times as far as regulations go is with the Obamacare's federal regulations, they often duplicate what a lot of states already have on their books. Prior to Obamacare, most states really regulated healthcare or health insurance very well, and there's just a lot of impediment through the federal government. Now, one thing that we definitely need to see to improve the market is we need to stabilize the non-subsidized health insurance market, because Obamacare is a heavily subsidized program. That's why it worked well the first couple of years. But you can't subsidize Obamacare indefinitely. That's what's really harming the market. Now, one thing that we do need to do if we propose a healthcare bill is we still need to protect grandfathered in plans through Obamacare. And I know President Trump has already said that he wants to do that. And most people in the GOP, when they present healthcare bills, they seem that they're behind grandfathering plans in. But one thing I also think is very important for a healthcare bill to be proposed was we need to end coerced conscious measures. I support abortion, which is not a very common belief on the right. But even to that extent, I don't feel that we should require people to fund abortions, which is happening through Obamacare. I don't feel that we should use the government to force people that are opposed to abortion to fund it. But, I'm going to go into a couple insurance-based reforms that I would want to see in the market. In an overall sense, the goal that we'd want to see out of a bill is to increase the competition and allow more choice for the individual. Currently, most plans don't fit the individual very well. You look at the different essential provisions that Obamacare requires for individuals. Like, for example, if I was to get on Obamacare, I would have to pay for potential maternity leave, even though, as a man, I can't have a child. there are a lot of different things as far as insurance goes under Obamacare that would require you to pay for things you would never use. The plan isn't individualized to you. Health insurance, in the hypothetical, should work the same as most insurance. It should work the same as car insurance, housing insurance. It needs to be designed to you. But as far as health insurance currently stands, that's not how it works. Let me go. I wrote down a long list of different things that could be improved. So I'm just going to go through some. When looking at health insurance, there are two different markets. There's the individual private market, and then there's the employer group market. Now, at the moment, most people get their health insurance through their employer, which I know, Bobby, you kind of have some takes on as far as like tax reform could be placed on employer plans.
Yeah, so one of the ideas that I had was that I think one of the things that you were going to mention was that you kind of wanted to get rid of that to a degree. Was that correct? Or at least
Preferably. The thing about like employer group insurance is it really gets people to focus on just making co-pays, and they don't really understand the price of things they're buying, and they do negligent healthcare transactions that they wouldn't do otherwise because it really abstracts the prices away from them. Personally, I believe that, you should just subtract that from the benefits given and just give the individual that income as they need. Because, if you allow individuals to just shop for their own insurance policy, most likely they can find a cheaper one in most markets.
Well, to go back to what we were saying, one of the ideas that I was having in terms of a tax benefit was if you have a business that doesn't provide insurance to their employees, but does actually pay for medical bills for certain procedures, you should allow that business to deduct that from their taxes. So that way, they wouldn't necessarily have to provide for all for all insurance, everything. You wouldn't even have to have copays. But if a company said, hey, if certain things happen to you, we will pay for that medical bill. Allow that to deduct them off their taxes. That provides an incentive for a company that, even though they don't provide insurance, to at least pay for something because it helps them in the long run.
Yeah. And, I'm sorry. I had a thought, but it lost me. What would kind of tax reforms would you want to see on the individual basis?
On the individual basis, pretty much what I would have is if you have any out-of-pocket expenses that not necessarily are things that are covered by your insurance, go ahead and be able to deduct those. Because what that would do is, instead of having your insurance pay for everything, which, every time you use your insurance to pay for something, you're going to have to pay like, a deductible on it, or your copay might go up, or your premium might go up if you start using it more. But if you have small out-of-pocket expenses, you should be able to deduct all those 100% off your taxes at an amortized rate. So, like if you have something that's pretty expensive and the hospital charges you a bill for it, but they charge you monthly and it's on like a 2-year plan to repay it, whatever you paid for that first year, deduct that, and then the second year on the second year's taxes. So that pretty much it incentivizes people to, I don't really want to use the word spend wisely, but if you do pay for it, that's that much less in taxes that you'll have to pay.
Well, it is kind of spending wisely in the sense that they're not referring to their insurance to pay for smaller health things. If you look at this from the perspective of insurance in general, say for car insurance, I would never use my car insurance to pay for an oil change. That doesn't make sense. My car insurance only exists to prevent, big expenses. Say I crash my car. In the same sense, that's generally how insurance for health should be. More big emergencies. That's why I'm a big proponent of, say, health accounts, where you pay into a health account and you use that, which would over time gain interest, and you just use that as a measure to pay for large medical expenses. And I think it would be very good for, if you continue to use an employer-based system, just have them to pay into a health account.
Yeah, and my idea is, if you did have something like that, you should be able to deduct that off your taxes as well. It's just like right now, when people have like IRA plans for their retirement, there's a difference between a traditional IRA and a Roth IRA. But under the traditional one, you get to deduct what you pay in as taxes, and then when you take it out, you have to pay taxes on that. But a Roth IRA, you pay taxes now, and when you take it out, you don't have to pay taxes. So if you set that up almost like a traditional IRA system, but as like for medical expenses, you can deduct that from your taxes, and then once you use it, you don't have to pay, tax when you use it because that's not something you'd pay tax for normally. So that would also give an incentive for people to save more money in terms of, putting it aside in that health account.
Yeah, it's kind of using the principles that you'd see in like market investment, but just applying it towards investing in your own health insurance.
And if companies use that money and actually like did invest that the way that companies normally invest money, that would be able to dramatically increase, the value of what's actually in there without you having to put even more money in.
Yeah. So one of the biggest things about Obamacare that is highly people don't like it is the individual mandate, which has always been the biggest focus of the GOP to get rid of it. Now, if you look at the American Health Care Act, they say that they're getting rid of the individual mandate, the fine that you'd have to pay if you don't get health insurance. But really what the GOP has been doing with their health care bill is they privatized that to where you'd have to pay a 30% surcharge to a healthcare or a health insurance company if you're off a plan for 2 months, and you'd have to do that for a year. So you're still being fined for not having health insurance. It's still the government pretty much mandating to you, get this or we will fine you. So really, the GOP is lying when they say that they're getting rid of the individual mandate. This is actually worse what they're doing, in my opinion. But as far as the mandate goes, it was initially believed that by having every single person having to get health insurance, you can kind of balance it out to where the people that have higher medical expenses are compensated by having young people paying in the system more. But we've just been seeing that young people have been foregoing getting health insurance altogether, because what's the point of getting it if you're just pre-approved for all pre-existing conditions to get it? You could just wait for when you have a health emergency or something. You can get straight onto the plan then. And what we want to do is we want to incentivize people to be proactive and get a health insurance policy young and stay on it. We want to de-incentivize, bad behavior and just not getting it. So then people do have a reason to get it. One thing that the market was especially moving towards in a direction prior to Obamacare was a thing called health status insurance, which would be essentially a way where you could work around the need for pre-existing conditions. Because, I'll explain in a minute down the line, pre-existing conditions, the Obamacare mandate is not actually as beneficial as most people believe. But how health status insurance works is you pay a slightly higher premium rate. It's separate from health insurance, but it ensures you to pay the same premium rate that you pay prior while you're still a healthy individual. You're betting against towards the future. If you get some sort of crushing pre-existing condition down the line, you're still covered for that. And with how health status insurance works, that's still portable. You can carry that over to different health insurance plans. I believe Health Group was really pushing towards this back in 2008. I was reading about it earlier. But, yeah, I just got to go through my list a little bit. Hard to keep track of all these things.
It's a pretty long list, so it might as well
Very, very long list of different things you can do. Because health insurance is just super crazy at the moment. But one thing that has always been stressed, even through the Trump campaign, is the need to have interstate competition. As we were saying before, there are states down to 1, potentially 0 insurers in their state. And as I said before, we need to increase competition. so there's more options for people. We can get their price down. So we need to get some reciprocity agreements. It's a difficult word to say, where we allow people to buy policies across state lines. So, if there's a good insurance plan for me in Oklahoma, why am I not allowed to buy that plan if it fits me best here living in Texas?
And also, if you think about that from a free market standpoint, that also kind of incentivizes states to compete amongst themselves to offer more in their plans to get prices cheaper. So, just like everything, that would help people out.
Yeah. And this works off the idea of how, opening the market and getting government intervention out of the way will lower the costs. And if you look at the consumer price index since 1996 to 2016, you can look at, covered to inflation where prices rise. And industries where there aren't a lot of government intervention, TVs, cell phones, years ago, smartphones were so expensive. So expensive. I couldn't afford to have one. Now it's affordable even for people that are poor to have a pretty good phone.
Yeah, I was going to say, when the iPhone first came out in 2007, it was only on AT&T, and you had to sign a 2-year plan. And that 2-year plan plus the phone on AT&T was $2,000 in total.
And it works.
And now, almost every single phone carrier has iPhones, as well as Samsungs and other smartphones. But, we're to the point where they even give you a phone for free just by, joining them and signing a new plan.
Yeah, because we don't have, regulations for the most part on cell phones in the country or TVs or all these products that we see prices go down, software, clothing, even cars we don't really see too much. It is below overall inflation. But if you look at the two things that have the highest growth over the period since 1996 to 2016, we have textbooks as the number one, followed by college tuition, then childcare and healthcare. All four of those industries are heavily influenced by government intervention. The reason why textbooks and college tuition are so high is because the government provides so much through these Pell Grants and financial aid, because it's guaranteed money to these college state institutions. If it was down to a point where people, what they're supposed to be actually investing in the future and making a calculated risk through loans, you wouldn't see as many people going to college, but the colleges will have to react to that by offering lower prices, as opposed to where, at Texas State, they just keep on building new things, building more dorms, because they just want to get more people in. It doesn't matter. The money is guaranteed by the government. In the same sense, we see that in the healthcare industry. There's so much intervention in the healthcare industry. There's so many regulations. We don't allow health insurance plans to be innovative and create new plans that accommodate people that are lower income because of what Obamacare mandates. Obamacare was envisioned to be this big bill that's going to, help out the poor man at the bottom of the totem pole. But in a lot of sense, it's helped the larger insurance companies because it's guaranteed money through the government through subsidies. Yeah. So one thing as far as employer group coverage, if you go back to the 1996 HIPP law, which was actually a very good law in the books as far as it was before we changed it. As far as pre-existing conditions go, because I know that's so many big people's fear as far as getting rid of Obamacare. Even though if you look at the numbers, the people that have pre-existing conditions that would be subject to, say, being priced out of the market is actually really small. It's only something like 500,000 to 1 million people if you look it up. The number really surprised me. I didn't know that before. So, when these Democrats go on the TV and say, like, oh, these millions of people will be off coverage, all these people are going to be dying in the street, that's not really the case. Those 500,000 to 1 million people would just go on Medicaid or Medicare, and they're probably on that already. Which Medicare and Medicaid reform is dire. It's not a choice at this point, but I got a lot of stuff on that later. But as far as the 1996 HIPP law goes, it set the rules for employer group coverage and specified that individuals switching from one plan to another could not be denied new coverage or be subject to pre-existing conditions exclusions or have increased premiums for existing conditions. And individuals could still get on an employer group coverage. It could not face a condition exclusion for more than 12 months. So really, how we had it before, in a sense, was a great standard. And we left it to the states to regulate for the most part, and it worked pretty well. I mean, facing condition exclusion for a while wouldn't be too good, but for a year, that would be kind of worth it just to still have it down the road. Because, if you look at healthcare cost over a lifetime for someone that has a critical pre-existing condition, it's going to be a lot more. And one thing people don't really understand about the individual mandate and how it, requires people with pre-existing conditions that are more expensive than it would be to cover them. One way insurance policies get around that is they just don't really offer services towards those people. If someone, say, has MS, which is a pretty debilitating condition that's going to require thousands upon thousands of dollars throughout someone's life to treat, what most insurance companies do in this market, since they're required to cover those people, is they just kind of cut those services from their insurance altogether. They won't offer those services through hospitals. They won't have physicians that cover that on their insurance. To where you're not even allowing a growth for a plan to cover those people at all, which we were seeing before Obamacare. Most people don't realize that. I know the Cato Institute has actually a really good article on that. Let me see if I can pull that up for a second. Yeah, I'm gonna read through this a little bit. It's a pretty good article. It's only like a page and a half. How Obamacare Punishes the Sick by Michael F. Cannon. This article originally appeared also on the Wall Street Journal on February 28, 2017. Okay. Republicans are nervous about repealing Obamacare's supposed ban on discrimination against patients with pre-existing conditions. But a new study by Harvard and the University of Texas Austin finds those rules penalize high-quality coverage for the sick, reward insurers who slash coverage for the sick, and leave patients unable to obtain adequate insurance. The research estimate a patient with multi-cirrhosis, for example, which is why I was using that example before, because it's a pretty good way to calculate it, might file $61,000 in claims. Obamacare's rules let MS patients buy coverage for far less, forcing insurers to take a loss on every MS patient. This creates an incentive to avoid enrolling people who are in worse health by making policies unattractive to people with expensive health conditions, the Kaiser Family Foundation explains. To mitigate this perverse incentive, Obamacare lobs all manners of taxpayer subsidies at insurers, yet the researchers find insurers still receive just $46,000 in revenue per MS patient, a $14,000 per year per patient lost. Predictably, that triggers a race to the bottom. Each year, whichever insurer offers the best MS coverage attracts the most MS patients and racks up the most losses. Insurers that offer high-quality coverage either leave the market, as many have, or slash their coverage. Let's call those losses what they are: penalties for offering higher quality coverage. The result is lower quality coverage for MS, rheumatoid arthritis, infertility, and other expensive conditions. The researchers find these patients face higher cost sharing, even for inexpensive drugs, more prioritized requirements, more mandatory substitutions, and often no coverage for the drugs they need, so that consumer cannot be adequately insured. The study also corroborates reports that these rules are subjecting patients to higher deductibles and cost sharing across the board, narrowing networks that exclude leading cancer centers, inaccurately provide directories, and opaque cost sharing. A coalition of 150 patient groups complains that government fostering race to the bottom completely undermines the goal of the Affordable Care Act. It doesn't have to be like this. Employer plans offer drug coverage more comprehensive and sustainable than Obamacare. The pre-2014 individual market made comprehensive coverage even more secure. High-cost patients were less likely to lose coverage than similar enrollees in employer plans. The individual market creates innovative products like pre-existing conditions insurance that, for one-fifth the cost of health insurance, gave the uninsured the right to enroll in coverage at healthy person premiums if they developed expensive conditions. If anything, Republicans should fear not repealing Obamacare's pre-existing condition rules. The Congressional Budget Office predicts a partial repeal would wipe out the individual market and cause 9 million to lose coverage unnecessarily. And contrary to conventional wisdom, the consequences of those rules are widely unpopular. In a new Cato Institute/YouGov poll, 63 of respondents initially supported Obamacare's pre-existing condition rules. That dropped to 31% with 60% opposition when they were told the impact on quality. Republicans can't keep their promise to repeal Obamacare and improve access for sick without repealing the Affordable Care Act's penalties on high-quality coverage. So as you can see there, really, you're hurting the quality of coverage that these people are able to get. You're de-incentivizing insurance policies to be developed that will meet the needs of these people. As I said before, health status insurance and was on the way to create a product that would actually cover these people. But, you're just creating a situation where people have debilitating conditions and you're giving them worse care overall. I don't see the point in doing that. If you can help these people, maybe overcome their conditions, that's definitely more preferable than what we're doing currently. Now, let me go back to my list of all these different things I want to fix.
Yeah, we're half hour in right now.
Really? Man, it feels like 0 seconds talking about this stuff, but there's so much things to go into. One thing is we need to apply the same set of rules for individual coverage in the market. I'm sorry, I forget how you'd even describe to do that. I'm just going to move on. There's so many things to get into. So, Medicare reform. If you don't understand what Medicare is, it's for seniors over the age of 65, and some disabled people are on Medicare. Medicaid, in general, is for people that are poor, at-risk children. We see some elderly people on it and some parents. But as we've seen under Obamacare's revision of Medicaid, which I'll get into later, it actually increases who qualifies for it to 138% of the poverty line. So you're having people that aren't considered poor, being covered for Medicaid. But Medicare, which is, prioritized towards the elderly, as it currently stands, we spend $692 billion on the program in 2016, and that covers 58 million different individuals. We're driving entitlement spending to a very unsustainable level, and we're creating a long-term unfunded liability. This program, on the current path that we're taking it, won't exist for our future as young adults. There's a huge conflict as we're seeing more baby boomers retiring right now, which is why there is an increased need for Medicare. But we have even less people paying into Medicare at the moment. It's a very small group of taxpayers that even pay into Medicare. Now, structurally, there are four different parts to Medicare. There's parts A, B, C, D. For the most part, people are on Medicare Parts A and Part B. These are what you call fee-for-service Medicare. But it fails to provide for financially devastating catastrophic illnesses. And 90% of seniors that are on Medicare require supplemental insurance to cover the gaps in coverage, which includes that financially devastating catastrophic illness. If we were to do reform for Medicare, that is one of the most, if not the most important things that we need to fix. We need to cover for catastrophic illnesses that would devastate people financially. Now, as it stands, the best program under Medicare I would consider would be Medicare Part C, because it allows people with Medicare coverage to spend money on private healthcare plans, as opposed to Medicare Part A and B, and I believe D also are just through government-run healthcare, so it's kind of like a socialized plan to do it. Now, one way that, in general, this is how I see we need to fix Medicare. We need to transition it into a premium support program where the government allocates already how much they're willing to spend on premiums, as opposed to, just giving people this socialized medicine, but rather allowing people to get support for the premium. They know what they're going to get. We'll have a better predictability with their budget, because our spending for Medicare is through the roof. We currently have 58 million people on Medicare, but we're expected by 2030 to have 81 million people on Medicare. So we need to do something to make this viable towards the future. And I think, getting the government out of the way and saying to people, hey, you can get on whatever sort of employer-based insurance plan you want to get on, or whatever individual-based insurance policy you want to buy, that's fine. We're just going to say we're going to support you up to this point. And I think for most people that would really work. Now, one measure I'd like to see to make Medicare more sustainable is for Medicare Part B and C to increase their premiums from 25 to 30%, while keeping the hold harmless rule, which, if you don't know what that means, which I'd imagine most people don't understand what that means, it means Social Security is deducted from your Social Security to fund part of your health care insurance. So, it covers that in a sense that's affordable. By increasing the premium, it allows us to fund this thing better in the future. And another policy that we need to do is we need to remove the subsidies towards the wealthiest people that are on this program. As it currently stands, people that are 65 or above, regardless of how much money they make, they are eligible for Medicare. This is a hard program to fund as it is. If people can afford it, I'm sorry, you just need to pay for that yourself. Now, another proposal that the Heritage Fund put out was to increase the eligibility age from 65 gradually to 68, and that would increase the longevity of the program by increasing it to 68. It would take some people off, but in the long run, this could be a program that would survive to, the future. Which, if we don't do anything about right now, there's nothing we can do. I'm sorry, there are some steps that we need to do to fix this program. Now, as it currently stands, I said there's Medicare Part A, B, C, D, and it's extremely complex. There's so much bureaucracy and red tape to it. It keeps the costs of Medicare up. But, at the minimum, I'd want to see Parts A and B combined, where, the complex cost-sharing agreements could be simplified and unified to a deductible, uniform co-insurance rate that, covers catastrophic out-of-pocket expenses. We need to set a limit towards what people have to pay for that. Otherwise, we're just kind of failing in what we need to do to help individuals. Now, as I said before, I would want to see Medicare moved into a premium support system, which would work way better because we can allow the market to function. All these different things I'm talking about now is all dependent on us getting the health insurance market revitalized. Which, to do that, we need to allow competition across state lines. We need to get regulations out of the way so, it's actually affordable to get into the market. Another thing we need to do, as I said before, is we need to get rid of the individual mandate, and we need to get rid of the pre-existing conditions mandate, because we need to allow companies to actually take risk-based assessment of their policies so they can actually start making some money off these things. If we do that, these companies are going to have more money that they actually spend on people with pre-existing conditions. They can actually get these prices down in the long run. And if we were able to do that, we'd be able to see results not that long down the line, probably by 2018.
And one of the ways that you can do that, for those of us that at least have the basic knowledge of our tax code, there's a lot of stuff in there that is incentives for people to do things and for businesses to do things. And you can actually provide tax benefits to incentivize insurance companies to offer plans that cover pre-existing conditions. And one of the ideas that I had, and this is kind of I don't really want to say it's a sketchy idea, but it's a lot more complicated than it sounds. But what you could do is, if companies offer pre-existing conditions coverage plans, the revenue that they take in from that, or at least the taxable revenue of that, was what you could do is if you look at their total revenue and look at the percentage of revenue that came in from their pre-existing conditions coverage plans, and then only pretty much tax the percent of their taxable income as to what their normal revenue is from. So they'd pretty much be not taxed on all the revenue that comes in from pre-existing coverage plans, which gives them more money to be able to actually use and provide those benefits.
Which gives them reason to actually want these customers as opposed to shunning them away. Which, as I said before, most people believe under Obamacare we're actually providing better for people with pre-existing conditions, but that's not the case. There's no incentive to have them on as the plan as the market currently stands. But if we can make it actually affordable to bring on everybody, we could see the status of these people with these debilitating conditions actually improve. Which, before I started researching this stuff, I didn't have an understanding in the world how we could do that. But once you kind of delve into all these different ways you could do it with tax reform and different insurance policies, there's definitely a way around the pre-existing condition mandate. Now, one thing I would want to see as far as Medicare goes is we need to allow individuals to take the money they get and spend it on private insurance companies, because we want to stimulate the private insurance companies over the government, which is so inefficient. The best feature of Part C is the medical advantage that we allow people to have by spending their dollars in the private market. Allowing them to get better insurance coverage that is actually cheaper. And, it would be best, I think, if we just let people, if they went out of their way to buy a policy outside of the government, to just pocket that money difference or put that into a healthcare savings account. There's no reason to penalize people for finding more affordable programs. That it just doesn't make sense why you do that. Now, to get into some Medicaid reform, which, as I said before, it's generally considered for poor people. It really is very low quality health care. Medicare is definitely a better program, even though, as I said before, 90% of individuals on Medicare have to find a supplemental private insurer just to cover their gaps in coverage. And sometimes they do that with Medicaid, and the inverse also is true. People on Medicaid also have to find often supplemental ways to provide for the gaps in Medicaid. Now, as it currently stands, in 2015, there's 70 million people enrolled into Medicaid, and it currently costs $554 million to pay for Medicaid. Many physicians reject Medicaid due to very low payment rates. Medicaid generally pays out to physicians 2/3 of what Medicare would pay. So, there's so many different insurers that just reject Medicaid altogether. Now, as I said before, Obamacare increases the eligibility of people for Medicaid to people that are 130% of the poverty line and below. Now, it really diverts the mission of Medicaid to begin with. It's supposed to help the poor, but by expanding it to 138% of the poverty line, what we've seen is tons of working age adults are now getting into the program, and money that could be spent on helping the worst off in our society is going to people that generally have an ability to pay for their own health insurance. What I'd like to see from Medicaid is trying to focus it down into different components. I think if we broke it down to the special populations program-wise, to say have one section focus on children, have one section to focus on the elderly, have one section to focus on parents, we could see plenty of efficiency just taken through that, because Medicaid is also a very expensive, very complex, very bureaucratically weighed down program. But if we tailored these programs down to these different specific populations, we could, one, make it more affordable by prioritizing certain aspects of it over others, and also, I'm sorry, there's not another point to that. Just my mouth's running a million miles a minute to try to explain everything off the top of my head. But, yeah, if we could eliminate funding for this increased population that we've added to Medicaid, it could still be a program that functions, and it would function better. As I said before, a lot of physicians don't accept Medicaid, but if we allowed the money to be focused more into these populations that are most at risk, we could see that increase, because the money would be more readily available to pay towards physicians. Now, what I would like to see is we create a per capita funding amount per specific eligibility groups, and that would allow these programs to be more manageable. It'd be more stable, and we'd have predictable budgets towards a focus on children and parents and the elderly. And this would, allow us to make large savings both at the federal and state governments. But what I would like to see is we need to divert Medicaid spending to be allowed to spend on private health insurances. How it currently stands, there's a lot of regulations on how you can even spend Medicaid dollars. Also, Medicare dollars if it's not Part C as it currently stands. I don't see why we should be getting in the way of allowing patients to make private contracts and agreements with doctors or physicians. That doesn't make sense to me at all. Now, what I would also want to see is the creation of personal accounts and counseling towards Medicaid enrollees. So one, we can give better control to the patients towards how they want to spend it, but also we want to have better decision making on the part of people with Medicaid, because people on the bottom of the social economic status that are people that are on Medicaid don't necessarily know how to make the best choices as far as health insurance or health care goes. But if we do take a focus where we don't currently have on making better spending choices through counseling, we could definitely save a lot of money through doing that. But by refocusing Medicaid in such a way, we could, as I said before, make the budget more predictable, the program more sustainable in the future. We can better address the specific populations that Medicaid was intended to help, and we could just provide better access through more successful healthcare models based on choice and competition. Now, now I just have some kind of general ideas that I'd want to see incorporated into a healthcare bill. One thing you want to do is you want to get the price of prescription drugs down. Bernie Sanders, I know he talks about this a lot. Pretty much everywhere in the world spends much less on prescription drugs than we currently do. And one of the biggest reasons why that happens is the FDA. On average, to create a drug, and this is quite unbelievable if you think about it. It doesn't need to be this way at all. On average, to create a drug, it costs $2.6 billion in research and development to get it approved through the FDA. There is no reason to put that sort of barrier towards getting drugs onto the market. If someone develops a better drug, why can't we allow the public to use that? It's up to the consumer to say, is this something I want to put in my body or not? There's always people in the street with their signs like "My body, my choice." Why can't we apply that same sort of thinking towards drugs? I don't know. There's also drug companies all across the world that we don't allow to send drugs into our market. We're really limiting ourselves in how we allow drugs to enter this country. And if we cut the regulations that we put on letting drugs enter the country, in another sense, we could also get prescription drug costs down.
And another way you could do that is by getting more prescription drugs to be available over the counter.
Yeah.
Well.
We also, put a lot of unnecessary burden just on getting over-the-counter drugs, which, as said before, it doesn't need to be that way. Now, let me see. Another point that I often like to make, which I used to make more back in my libertarian days. I remember I used this on a big political debate on campus, and even the socialists actually agreed with this idea. I believe this is called concierge healthcare. I may be wrong, but specializing hospitals to specialize in just particular surgeries. You can see this at the Surgery Center of Oklahoma. They actually streamline the process to only focus on doing a couple surgeries, where, as far as regulations goes for general hospitals, they require them to have so many different things, having to provide in so many ways the government regulates down. But if the consumer is willing to go to a specialized center to get a procedure done, where they keep the price down by only focusing on that, why would you not want to do that? If you look at the pricing for the Surgery Center of Oklahoma, the prices are, in general, about half of what a normal procedure costs,
And not only that, but, if you have concierge healthcare centers around the country, which I'm sure, they would start to be set up if you allowed for that to happen. And what you can also do is, to incentivize people to use those, you could also allow them to have a lot of tax benefits as well. And I know, most of what I'm talking about is tax benefits. But if you allowed people to deduct their airfare bills to fly there, their hotel bills while they're staying there, get a per mile gas rate that they can then deduct as if, like how people who drive a personal car for work can deduct the miles driven on their taxes.
which most people don't know they can do.
Yeah. More people should do that. But, allow them to do that. Then suddenly, if you're spending $10,000, $15,000 to go there, have a procedure done, and come back, if you're able to deduct that off your taxes, that incentivizes people to do it rather than using something, through their insurance at a much more expensive hospital because of, different things like that.
Yeah. Another program which I've seen pushed around, which I think might or might not be a good idea, but I know this has been used more in the past, is actually doctor subscriptions. Cutting out the middleman of insurance companies and actually just paying a monthly prescription to your doctor, and you just have unlimited coverage or access to your doctor if you're willing to, pay your monthly rate, which, I've generally seen maybe like $50 a month, which not the worst that you could have in a year. If you're someone that needs to go to the doctor more, one, it's better that you have a more focused connection to your doctor. Two, you're eliminating a lot of costs just by getting bureaucracy, insurance, and regulation out of the way. And three, you're just saving a lot by making this agreement where, you're already investing in a year's service of the doctor. You can get out of it as much as you need. Another way, actually, in the past, that this was actually the most common way in the United States health care was provided was through mutual aid societies. I think most people would be familiar with like Rotary clubs. Those are kind of the descendants of mutual aid societies. How it worked is people would, in a collective, pay into the collective. And if someone has a need for health, coverage, the collective actually just pays out for that. So you just pay membership into your mutual society, and it covers you for the most part. If you look how it used to be in the past, in a year, to cover insurance or cover healthcare costs for the average person a year, it would only be something like 6 days of work as far as costs go, which is substantially lower than what people have to pay now, where their Obamacare premiums are, in some places like more than their house payment, which is absurd. It shouldn't be that way at all. Now, another way that could definitely help get healthcare prices down in general is opening up medical schools. Doctors, they kind of have, in a sense, a cartel. They limit, actually, in most medical institutions, how many people they can graduate to be doctors. Because, it keeps up the wages of doctors high. But if we, did away with that and made efforts to not have that be the case, if we have a higher supply of doctors, one, we can help more people. Two, we'll get the prices down. Most people don't understand that, like, medical schools are kind of cartelized in that way to protect doctors. Yeah, I think those are, as far as my ideas go, those are the ones that I'm probably the best at explaining. I put down some other ideas, but they kind of are harder to explain how they work. Do you have any other ideas as far as fixing the tax code to helping individuals?
Yeah, just on top of some of the things that I've already mentioned, I won't go into too much detail, but pretty much one of the main things that I wrote is that if you pay for any out-of-pocket procedures, like not including like, regular checkups or stuff like that, but like big stuff, if your insurance doesn't cover that and you have to pay for it out of pocket, you should be able to deduct that from your taxes. I think I actually did already mention that, but that would not include things like, like unnecessary cosmetic surgery, like, breast implants, nose jobs, stuff that's unneeded.
Yeah.
But just, major stuff that you do need to have happen, you should definitely be able to deduct that from your taxes, as well as, like we said, removing the penalty, because that's one of the things that people really don't like to have happen. And I think one of the last things that I was going to say was, people pay their premiums. And as you said, some people's premiums are more than their house payment, which is completely absurd and shouldn't be that way. But if you can allow people to deduct more of their premiums from their taxes, then that, it saves them money at the end of the year when they have to send Uncle Sam a check.
And that's more preferable than us just getting the government trying to intervene. As I said before, the more government intervention we've seen that we placed into the market, the higher the prices have gone up.
And if you think about it, yeah, the government will be taking in less money, but that stuff is so heavily subsidized right now. The government's spending so much money on it that it's almost cutting out the middleman in a way.
Yeah, we're just throwing taxpayer dollars into the system. We can cut the bureaucracy altogether and just, cut that from what people have to pay into the system. But, yeah, I don't really have any other provisions or ideas that I wanted to pitch out. I hope I did my best to explain these ideas. This is one of the hardest subjects for me to discuss. I am no expert, but I do think I know a bit more than most people. I definitely know how Medicare and Medicaid work more than most people. And Bobby, you're an accountant, so you understand the tax codes way better than most people. But I hope this episode was more informative on what would be good to see in a bill. I don't know if the GOP is going to have a healthcare bill that has any of these sort of provisions. I hope they do. As it currently stands, it's more like Obamacare light, and they don't even get rid of the pre-existing conditions thing. And as I said before, they just privatize the individual mandate, which is garbage. But hopefully the Senate, which is working on it currently, can get it done soon. If they don't fix it in the month of May, which it currently is, you're going to have the rates for 2018 already set as far as premiums go. So 2018 would be the year that we see Obamacare premiums skyrocket through the roof, more than they already have this year. So it really is important that they get this stuff done now. If they don't get this stuff done, I do definitely believe that there's going to be a big push towards socializing into a sort of single-payer system, which, a lot of people, including myself, believe Obamacare was kind of designed to fail to eventually lead to that. But, and the Bernie Sanders people think that's such a great idea. But if you look at Canada, the United Kingdom, their health services have people dying all the time. If we can actually fix the market and get these things affordable, allow more insurance companies to get into the market, allow them to specialize plans to individuals, allow people to have more choice of how this goes, cutting the middleman and regulations so much, getting the government out of regulation business and health insurance, almost entirely, we could actually see, affordable health care, which the Affordable Health Care Act was supposed to do, but it really hasn't. Yeah, with that said, I don't think I have anything more to say, do you?
No, I don't.
Yeah. So we hope you enjoyed this show. I think we're just clocking in at the hour mark pretty much now. As I said before, we're probably going to have another one of these episodes this week, so stay tuned for that. But with that said, thanks for listening.
All right, thanks for listening, everyone.
See ya.
Bye.